That is so much fun. I know. Corona is trending fast. I know. Some are scary, some are funny, others too fake news. Then don't share. Why not? Go to the right place for Corona news. Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UK Aid.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice, Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Evening and welcome to all. Thank you once again for joining us this Thursday for the Health Talks, which is the health segment of Trend Africa TV. Today we have a very exciting show. So I'm going to give us some time so we can be able to invite all of our friends and family so they can be able to share the feed. Please take this moment and share the feed and we'll be right back. Thank you.
Good afternoon, Yamime. Achomi Nila Telai, aka Sterling. Yefane, meantime abtanya adafifioko. COVID neba ne, elakoni eba egbemewa. Ewo face mask na ke wo sani wo. Shi wana ake owo face mask ke chefio egbla otue ehan otue se shambo ewo ehan ni mepi anya wo keche na mejio shi woke no kombajara na emi ni wo ba ho anye na ba anye han owo face mask ke de lebi ka shi gbeke na eche yo otue ewo ni ene hu aka wo otue se akenmo kon se oku ese ne ba kan de ke face mask e ba blale ne ba momi abo bo ba nyo wo le lebi ka shi gbeke no jie ni onyo una ila na eko ewo ene ni wo ke mbajara na emi na ele wo ba ho anye ko ta wholesale price aloba fan no ya ho wo ye habo ko ta no ba ji oba hele 11 wo ye habo ewo wo number ni obanyo na wo ye no ne 0244 255 193 ko twawo efe no yo obanyo wo ke ba no oba ho habo no wo fe wo ya jowo because ila na ila gbonyo ni neba eba gbe wo san wo fe wo fo wo ya fa ba the one you are don ketwebo.
It's the creator.
Maka. Royal Black says the Abba. Maka. Entertainment and sports. Maka. I say politics. Maka. Royal Black says. Assembly Safwa. Bie Assembly Puno. Sane Pia de Kami. Ekome ya kotokumi, ekome ya misegbe, ni won lo feke hanye, maka. Royal Black says the Abba, maka. All the trending issues, maka. I say politics, maka. Entertainment and sports, maka. RBJ the Abba, where you full from crowd. Assembly Safwa, Assembly Puno.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to
Thank you once again for joining us, and for all who have just joined us, a big welcome to you as we are celebrating Ghana Month, which is the month of March. Today, as I said, we have a very exciting show, but before we get started, I'd like to invite the GNC Youth Secretary, who is going to be talking to us about the scholarship opportunities that GNC is going to be offering this month. Abena Ampafo, you are more than welcome to the program. How are you doing today?
Thank you so much for having me. I'm well. How are you?
More than fine. Thank you. We'd just like for you to talk a little bit about what Ghana National Council intends to do for the youth and how we're going to be showcasing it on March 15th, I believe. If you could give the viewers a little bit more information about that.
Okay. So, what we're doing is that we're developing a youth community stars scholarship program. So, what this program is going to do is that we want to start instilling things that for youth and for the rest of the community as we continue to grow on, will also be able to benefit and grow from as well. So, with everything that's been going on, we know that with the pandemic and everybody being in quarantine, and school and education has just been such a real struggle for students, GNC would like to help in their way. So GNC Chicago is donating $1,000 in educational assistance to students ages 17 to 22 living in Illinois and Ghana. So with that $1,000, it'll be broken up, and the winners, we will have 4 winners, 2 from Illinois and 2 that are in Ghana, and they will each receive a $250 scholarship to help with their education. The essay criteria, so there's a criteria in order to apply for it. So the criteria is that you need to be a student from ages 17 to 22, live in Illinois or Ghana, and also provide an answer to the essay question, which is, if you could create a law to affect change in your community, what would it be and why? With that question, please provide a 500-word essay, which includes your name, age, location, a picture of your school ID, your phone number, what grade you are in school, or your major of study. If you could put those submissions in to be emailed at info@gncchicago.org or at ghnACO@outlook.com as well. Make sure you put in the subject line that this is for the Community Star essay entry. And also, if you would like to include any photos or videos to support your essay, please do. We have extended the scholarship deadline. So the deadline will be Monday, March 15th at 12 a.m. So please make sure to get all of your information in. And I'll repeat the essay question again, which was, if you could create a law to affect change in your community, what would it be and why? And the reason for that essay question is that through everything that has been going on, our youth have seen a lot of things that sometimes we can learn from them. You can always learn at any age, and some things that they are more privy to as in terms of technology and maybe understanding how to use it in different fashions, they can also help educate us and let us know how it is that we who are in higher positions, how we can help them get their views across. So with that, it helps us also understand what resources we need to provide for them, and how it is that we can also provide more better implementation of things for the future.
Excellent. Thank you very much, Abena. And as you all know, Ghana National Council has been working very hard to be involved with everything that is going on in communities. So I just want to encourage all of our viewers, if you hadn't heard about it before, please make sure that your youth does go ahead and submit an essay. You can also follow us on Facebook and Instagram so you can get some more information. If you have any personal information or questions, always reach out to the youth secretary, who is Abena Ampafo. Abena, would you be able to give them an email address so they can be able to contact you, or a phone number in case they had additional questions or concerns?
Yes, so if you need to get in contact with me, please email at abena@gncchicago.org, and I will answer any questions. And also, we are also, in terms of looking to require more sponsors, our goal, at least the youth goal, is that we would like to at least sponsor 21 students this year. So we're always looking for sponsors so that we can give out more scholarships to more students and to also highlight what it is that they're doing in their communities to make a change.
Thank you. Thank you very much for that valuable information. Once again, if you guys have any questions or concerns, please reach out to Abena directly to answer those questions. We're going to take a short break, and I just want to let you know that we do have a gentleman here that's going to be speaking to us about intubation and ventilator use. When COVID-19 first began, if you can remember, we heard a lot of things about people saying that there was not a lot of ventilators, and there was a lot of concern about people's respiratory status. We do have a professional here with us today that's going to give us all the information. Let's take a quick break, and when I come back, I will introduce him and we're going to learn all about it. Please stay tuned.
The Post-G mix class is something the industry needs, because I have been part of so many conversations where the argument has been that songs coming from outside Ghana, let me not even go far, especially our Nigerian counterparts. So many people feel that their songs are well produced, well mixed and mastered than the songs we produce here in Ghana. I've had countless conversations with Post-G himself. So when I heard that he's doing the Post-G mix class, I said, okay, every producer needs this. So growing up, I was told that knowledge is wealth. So whatever you do, seek knowledge. My name is Sammy Flex. I work with Xylophone FM 102.1, and also I operate an online channel, Sammy Flex TV. I endorse Post-G's mix class. Everyone should be part of this.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back, and thank you for staying with us. I'd like to give a big shout out to our sponsors, Trend Africa TV, Ghana National Council, Omama TV, and Holiday Africa. As I said before we went on our break, intubation is a word that we heard a lot about when COVID-19 first came out. And they talk about it when they talk about seriously ill patients with COVID-19. However, before COVID-19 came about, intubation is something that has been used for several years. Normally, we hear about it when people have to go to surgery or they're dealing with serious conditions like COPD, pneumonia, or respiratory failure. Basically, when they're too weak to breathe on their own. Today, we are going to learn more about what intubation and ventilation has to do when it comes to COVID-19. I'm going to take my time and introduce a very important gentleman, Dr. Otis Osei. He was born in Ghana, migrated to the United States in 1996 to pursue his education, but joined the U.S. Navy instead. He obtained an associate degree in general science, Bachelor of Science, and a Doctor of Nursing Practice in anesthesiology while in the United States Navy. His current time in the Navy to date is 24 years. A lieutenant commander in the U.S. Navy and currently a chief of anesthesia in the U.S. Army base at Fort Meade. He's also a Navy-trained trauma nurse anesthetist and has deployed on 3 U.S. Navy aircraft carriers to the Arabian Gulf. He's currently also the vice president of the Association of Ghanaian Advanced Practice Nurses Abroad, an association that he says is very close to his heart as he loves to serve his fellow Ghanaians both in the United States and in Ghana. Dr. Osei is married with 3 boys, ages 17, 7, and 5. He enjoys lending a hand to others in need, reading, working out, cooking, fishing, and driving on long stretch roads. With no further wait, I'd like to introduce our very special guest, Dr. Otis Osei. You are more than welcome to the program today. How are you doing?
I'm doing very well. Thank you. Thank you so much. That was an impressive introduction. That was very impressive. I'm honored to be here.
We're so happy that you're here, and we are very excited to hear all about what you do and all about your job. So let's get started. Tell us a little bit about your profession.
Well, I am a nurse anesthesiologist in the United States Navy. I hold a doctorate degree in that field. My job is very broad. You know, in the hospital, I have a hand in almost every part of the hospital, but the basic of my job is in the operating room. So every given day when I'm in the hospital, chances are I'm in the operating room performing, getting involved with surgery. So in anesthesia, my job is to make sure that the people coming for surgery, they are safe, first of all, and also they don't feel the pain, and they also don't care about what's going on when the surgeon is actually kind of away and doing what they do. So that's the gist of what I do. Other portions of my job involves emergency situations. So I'm involved in the emergency room. Sometimes someone will come in that has problem breathing, and they need their airway or their lungs protected. They will call me immediately or emergently to show up and take care of that. So that's a portion of my job. I'm also involved in the intensive care unit. If they need the same care, they will call me. They will call me on the overhead mics in the hospital or the speakers, and I have to run to such places. And little other things that the other floors may need help as well. And also delivering babies. That's one of the jobs that I love doing epidurals, spinal C-section, things like that. Yes.
That's wonderful. And tell us a little bit about AGAPNA. I learned that you're the vice president of AGAPNA. How did you get involved with AGAPNA?
All right. So AGAPNA, that's something that I really enjoy being part of. It's the Association of Ghanaian Advanced Practice Nurses Abroad. So AGAPNA was formed in 2019 by our president, Mrs. Mercedes Babi. So it's made up of nurse practitioners and nurse anesthetists, right? So nurse anesthesiologists, and it's APRN, basically advanced practice nurses. And the reason why I know that there's all type of nurses, and we kind of focusing or zoomed in on just two classes, nurse practitioners, and we wanted nurses that can involve themselves in the clinical aspect of care, so disease management, right? So the nurses in AGAPNA, our mission is to improve the health and the knowledge of Ghanaian community, both here and in Ghana as well. So we want to be able to get involved in the clinical aspect, and the two type of nurses that are able to do that is just the nurse practitioners and nurse anesthesiologists so far. So we are based in the US. We are in every state. Our members are spread across, and we currently actually, we're new association. We've done a lot of work. We're still looking for more members to join us. So we're calling out all Ghanaian nurse practitioners, Ghanaian nurse anesthetists. Also, even if you're not Ghanaian and you're married to a Ghanaian, your dad is, or you were born here but your parents are from Ghana, or you can even prove that you have some type of Ghanaian connection, and our board will approve it, we will definitely accept you.
I love that. I love that. And AGAPNA is a wonderful organization, which I happen to be a part of myself. So we are very excited. And as Dr. Otis say, our invitation is open to everyone. Please visit our website, check us out on Facebook and on Instagram. And if you are an advanced practice nurse, our doors are more than open, and we would love to have you there. So we're going to keep on going on. So how long have you been chief of anesthesia department at the U.S. Navy base? That's a huge title. How long have you had that?
So my job I love also. So I do multiple jobs. The reason why I'm able to do that because I'm in the Navy, right? So in the Navy I wear two hats. So I have a professional job and then I have an officer's job. So I'm a lieutenant commander in the Navy. That title alone requires me to be in a leadership position, right? So some type of management position. So the chief of anesthesia, what I do is manage the staff in the anesthesia department. So my job is to make sure that we have the staff to perform anesthesia, that the surgeries that show up through our door can be done there appropriately and safely, and also manage equipment, make sure that we have everything that we need to make sure that the anesthesia happens for patients showing up. So it's more of a management. It's an office job, kind of sort of involved in hiring new staff, things like that, hiring the appropriate staff, the right credentials to be able to do anesthesia the right way.
So is this civilian based, or is this for the people actually in the Navy?
So in anesthesia, it's kind of mixed. The population is military. So military or military related, that's our patient population. So we don't really we don't cater to civilians. Okay. So the patients that show up, either you are, first of all, military, or you're married to military, or you're a child of a military member, or maybe some type of parent, right? Now the staff that work for me, it's mixed. So there's civilian and there's also military. And the reason why we do that, the military has in the hospital, you're going to see that we have also what we call the Department of Defense support staff who are not military, but they work for the U.S. Government. And we do that because just in case the military staff is deployed overseas fighting war somewhere, the hospital still can stand and operate.
Oh, okay. Oh, that makes a lot of sense. Oh, wow. Wow, very, very interesting. We're
Yeah.
going to take a quick break, and when we come back, we're going to dig really deep into COVID management and what Dr. Otis's job is with COVID management. Please stay tuned and share the feed. We'll be right back.
All right.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMB and they'll give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile doctors, the doctors in your home.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back, and thank you once again for tuning in to this very important segment of Trend Africa TV. And this segment is entitled Health Talks. We are just having a great discussion with Dr. Otis Osei. He was telling us about his job as an anesthesiologist. We're going to go ahead and dive right in and find out what we've been really wondering about. How does COVID-19 management have to do with intubation and ventilators? We've all heard it all over the news. If you guys can quite recall, when COVID-19 first came out, everybody was saying that there's not enough ventilators in the hospital. And we hear that people are intubated and they're extubated and all these questions we have. So Dr. Otis is going to break it down for us. So my first question would just be general. What exactly is intubation and why are ventilators sometimes necessary for the use of COVID-19 patients?
Yeah. That's a bit. I will break it down. So first, I'm going to talk about what intubation is. So intubation, in a very simplest form, is to place some type of tube, which you call an airway, so endotracheal tube, into the patient's trachea, right? So the patient's airway, where you breathe in and out to protect your lungs. So what that does for us is that it gives us the ability to be able to give you oxygen without you breathing on your own. Right, so that's intubation. The placement of the tube itself, the endotracheal tube into the airway, is what intubation is.
Okay. And so that you said that protects your lungs. So then when we first heard about COVID-19, everything was basically based on respiratory. About 2 weeks ago, we had a cardiologist on board who really went in very great detail to tell us about all the cardiac effects that COVID-19 has. So do you think that protecting the airway, like protecting the lungs, is that really priority when it comes to COVID management, or is that secondary? Or what just happens that someone goes in, has COVID symptoms, and all of a sudden ends up on a ventilator or needs to be intubated?
Right. So when you talk about COVID, it's a respiratory disease. That's what we all know. So, we wear a mask for a reason, right? So first of all, the way I describe the lungs, it's like the gateway to your brain, right? So your brain relies on oxygen, second by second oxygen to survive. So if you hold your breath, you're gonna force yourself to breathe, right? If someone blocks your neck and you can't breathe, you're probably gonna die within minutes or maybe sometimes seconds, right? So when COVID happens, it compromises your lungs, right? So the lungs is where the oxygen exchange happens. Oxygen and CO2, carbon dioxide exchange happens. And when your lung cells become affected because of all this inflammatory media is going on, just initiated by the COVID virus itself, then the cells that are available to involve in this just oxygen and carbon dioxide exchange is limited, right? So you have problem breathing. So is COVID-19 a lung disease? Yes, that's where it starts. So we hear about all this coughing, things like that. So you imagine your lungs in a normal person is two-sided. You take an air in, you breathe it out, and oxygen exchange and carbon dioxide exchange happens, right? And when this side is limited and there's not enough space for it to happen, you're gonna have problem breathing. You're gonna be hungry for oxygen, right? So for us, as far as anesthesia, the biggest thing that we do all the time is to protect people's lungs. So if you're gonna have surgery, first of all, I'm gonna render you unconscious. I'm gonna give you medications so you become unconscious. Once that happens, I have to breathe for you, right? So I place a tube, like I said, intubation into your trachea, your airway, and that allows me to give you the precise amount of air volume that you need in your lungs, and also allows me to give you the amount of oxygen I want. And I can bring it down, bring it low, and kind of maneuver it around to an effective desire that I want, right? So when you bring on to COVID, COVID now is a lung problem. That's where it starts, right? And it becomes a total body organ problem. So anesthesia is immediately involved because we are expecting protecting the lung, not just taking care of the diseased lung, but protecting the air exchange, right? Making sure that happens, making sure there's always an airway. So that's how we are involved. So if you get COVID, you can't breathe, right? I'm talking about people that get COVID, that get really symptomatic, end up in the hospital. Before anesthesia is involved, really, a lot of things have been tried first before anesthesia is called. When we come in, our job is to make sure that you can breathe, right? So it's a last resort type of thing that we do.
Wow, that's what I was going to ask. So when anesthesiology gets involved, that's the last resort.
Yes. So there's, and let me throw a scenario. So in the hospital, the care of COVID is protected by, protocols.
Correct.
Right. So when you look at someone that gets COVID in the general population, let's say 10,000 people get COVID, right? Very few people end up in the hospital. It's not a whole lot, right? So I think the number is about 5% people will become symptomatic to a point where they need some type of hospitalization. And those people, so you take 10,000 people, then you have 500 people that end up in the hospital, right? And then out of these 500 people, we see about 5% of them is going to end up in the ICU, intensive care unit, right? So when someone shows up in the hospital, they're having problems. Something brought them there. They can't breathe, right? And then from that point on, they say, okay, we're going to give you oxygen. So that's where it starts. They give you a little bit of oxygen in your nose. They admit you to the floors, and you are doing okay. Maybe a couple of hours down the road, you're not breathing well, right? And then they increase the oxygen for you. Now, at this point, anesthesia is not involved yet. It's not critical. The person is able to breathe, they're awake. And then eventually, as the lung cells continue to deter and break down, your hunger for oxygen increases because you're not getting more oxygen. So your work of breathing itself, the energy that is involved to taking air is increasing. That means you are using a lot of your body energy. So you eventually get tired, right? You breathe really fast. So at that time, you're going to need some type of support. The little oxygen is not helping no more. So the first support, some of the support they do, CPAP, right? Continuous pressure airway devices are used, and also BiPAP. These devices are used to kind of force oxygen into your lungs, kind of help you. You are still breathing on your own, but anytime you take a breath, it pushes the pressure, oxygen into your lungs and kind of help you there. And then if you fail that, at that time, anesthesia is informed that, hey, we have this person. Most of my patients that I've intubated are in the ICU, intensive care unit. That's where it happens. I've intubated some people in the emergency unit because they come in emergently. But most of the time, it's in the 5% that end up in the ICU, right? So now we went from 10,000, 500 in the hospital, 50 now in the intensive care unit, right? So the number is smaller. but those are the critically sick people, right? So those people, when they cannot breathe, I get called, right? So when I get called, the protocol is initiated, right? When somebody has COVID, it's an airway disease. We wear masks for a reason. So if you're gonna go into the airway, then you are putting yourself at risk also, right? So when you get called, you follow the protocol. So first, you want to protect yourself, protect the staff around you, protect the patient, right? So how do you protect yourself? You wear a mask, you wear some type of eye protection, so shield or goggles. You wear some hospital gowns to cover your scrubs. You wear some things to cover your shoes. And then you meet with a team and you discuss, everybody discusses their roles, like, hey, what are you going to do? What am I going to do? And so we know what's going to happen. And then you come with other ways also to protect the patient, to protect the staff. So the staff is also dressed up to go into the room, and you all go into the room. And then the intubation happens. The patient is protected because everything is done really quickly to make sure the patient is alive and safe at the end of the procedure.
And how long would you say that COVID-19 patients, like let's say someone was pretty severe, how long have you seen that you have to keep them intubated?
The numbers are really stretched out. So I've seen anywhere from 2 days to 8 days. Of course, there's patients that goes longer than that. I think somewhere between 2 to 8 days. Unfortunately, some patients start passing away, right, to the 8th day or early. The numbers kind of say that patients that end up getting intubated for a longer time sometimes survive, they make it. So it doesn't matter you were intubated or you stay on the ventilator for 2 days or 8 days, that's where you survive. So the numbers, currently, of course, COVID is new and every hospital is collecting data to kind of identify the trends and stuff like that. So it's still going on, but I think 2 to 8 days is what I've seen as an average.
2 to 8 days. And so are there any risks or complications that could potentially happen when intubating someone?
Absolutely. Absolutely. So intubation involves a lot of risk. So even in anesthesia, I think when we wrote a protocol for COVID intubation, it can only be done by very experienced anesthesiology, right? So if you haven't been doing this for a long time or you don't intubate a lot, you will not be called to intubate somebody because the patient is at risk. So the way the intubation is done, we call it rapid sequence intubation. That means the intubation itself is done very quickly, right? That means the patient airway exposure, some type of risk is decreased, and also exposure to people around the patient is decreased. So first of all, when a patient needs to be intubated, when you walk, this is what I see when I walk in, the patient is obviously in distress. They have some type of respiratory distress. They can't breathe. You can see they're trying to suck in air and they're really struggling. Now, I still have to talk to them, right? So because the patients, most of them are confused, but you treat everybody the same. They have dignity. It could be your mom, it could be your dad, it could be a family member, right? So everybody have dignity. So you still talk to them calmly, tell them exactly what you're going to do and how you're going to do it. Once that's done, you have to give a medication to render them unconscious because you can't put a tube through someone who's awake. It's going to trigger a whole lot of reflexes. They're going to throw up on you or cough and do some bad things. So throwing up. So first risk of intubation, right? Someone can throw up. You can make a bad situation worse by putting a tube into somebody's throat. They end up throwing up and aspirating into on their own vomit into their lungs. Now their lungs, that's already compromised. Now it's even worse.
Mm-hmm.
Right? That's a risk. That's a way to protect that, right? So the way we protect that rapid sequence intubation, when I get ready to intubate you, I give you some type of anesthetics that renders you unconscious. I give you muscle relaxers that makes your head, the ability to maneuver your airway becomes much easier for me. And I know that when you place the tube, it will go smoothly. And then someone will put their fingers on your larynx here to push it down to make sure that there's no food that's going to come from your stomach into your lungs. So that's how we mitigate that risk, right? And then sometimes we use video laryngoscopy, which is you can use a video to look into the person's airway and see where you're going to go. So it makes it much easier. It's not always, right? But that's there for you to kind of make the process faster for the patient, right? So you can trigger what we call a bronchospasm, right? Or laryngospasm. So your airway, your vocal cord itself, when it's triggered, when the patient is not sufficiently anesthetized, it can cause the airway to close up because it's trying to protect itself, right? So you want to make sure that the person that you are going to put a tube through their throat is sufficiently anesthetized and absolutely unconscious before you place the tube, or you're going to have bad things happen also. So that's some of the risk, and we mitigate that by giving muscle relaxers and giving enough anesthetics to make sure the patient is going to be all right.
Wow, that's interesting. I love what you said about the dignity and explaining everything fully to the patient, no matter what condition they're in. I think that is so encouraging for all of us. I mean, because you never know when you're going to end up in the hospital or if your loved one's going to end up in the hospital. So it's nice to hear that someone who's in charge of something so important as protecting the airway still takes the time to really explain to the patient what's going on, regardless of their cognition status. So that is very admirable. And that is what we've all been called to do as healthcare professionals. So tell me, what does recovery look like for a patient who's been extubated? So let's say they've been intubated for, maybe 3-4 days, and you guys have been monitoring their airway. I can imagine that gives the patient enough time to rest, medically, even when you think about all the strenuous things that you go through being intubated. So let's say this person becomes extubated. What does recovery look like for that patient?
So when the patient is the anesthesia management is for the portion of intubation and sometimes extubation, not always, right? We get involved in extubation where there's a risk of re-intubation. So sometimes, when the patient, you have to meet the extubation criteria once you are put on the ventilator. And by the way, I don't think I explained what a ventilator is now that I think about it. So the ventilator itself is the machine. Once I put a tube through your airway, which is your trachea, now something has to breathe for you, because first of all, I rendered you unconscious, made your muscle relax so you can't breathe anyways. So I put you on a machine that's going to provide oxygen and air to your body, right? So the machine itself is a therapy because it's able to push enough pressure into your lungs to kind of force the lung itself to open up, right? And also we can kind of manipulate how much pressure, how much oxygen, and where we want it to go, and what type of airway we want it to open. So it's very unique. So it's a very complex machine that can do a lot of things, right? So once you get put on that machine, that's why I say, the average is about 2 to 8 days. So during the time, you're getting taken care of by the intensivists. So ICU doctors they take over because, COVID is a multiple organ disease. Yeah. So it's not just your lung that's involved. Like you mentioned, there was a cardiologist here that explained how it affects your heart and blood system, right? It affects your kidneys, your liver, and other system, including your brain. So this, every hospital has a regimen that they use to treat a COVID patient. So you are treated aggressively once you get put on the ventilation, and this can go on for days or a few days. Now, as you get in treatment, they are checking your labs, right, results, things like that, to see where you are as far as the therapy. And once they can determine that maybe you've met the therapeutic point where you're doing better, your blood levels are better now, then they're gonna reduce the ventilator, on you, so that you kind of take over your own breathing. They reduce the sedation that you are under. So you have to meet that criteria where you can breathe on your own. Even though the ventilator is supported, but at the same time, are you able to take a breath? Are you able to maintain a breath? Are you able to maintain your oxygenation without, supplemental oxygen? Absolutely. So once you meet that criteria, then the tube is removed, right? So by the time you meet the criteria, you are probably doing better, right? Your labs, your blood works, and everything will do better. So once the tube is removed, that day you are watched the whole day, of course, to make sure that you're gonna be breathing, and the therapy continues. And if you meet the criteria where you're able to breathe, maybe talk to people, you're oxygenating your brain, okay, you are not confused, you can recognize people around you, then you get discharged to a lower level floor. Okay. Right? So at that time, then eventually you get out of the hospital.
Wow. It's such an amazing process. So for everyone who's watching, I just want us to all understand. So intubation, as Dr. Otis described to us, is actually the process of them putting something into the airway. The ventilator is actually the therapy. So that is the machine. He explained to us that it's a very in-depth machine, very complicated machine that needs professionals to be able to regulate it. And it's an interesting process because when you think about how everything goes, the body itself, how does the body even know to begin to breathe by itself? And if it has that sensation to breathe for itself, what happens if it starts breathing for itself while the ventilator and the intubation is still there? Like, I watch a lot of movies. I feel like someone wakes up and they're all like rushing to the room. What is it like in real life? Is that what happens, or?
Well,
Probably not.
No, that's an interesting question, right? So the ventilator itself is a very complicated machine.
Right.
So there's multiple settings. For instance, what you just described, say, what if somebody on the ventilator start breathing on their own? Let's say all of a sudden they get better and they breathe on their own. So the process is, once you get put on the ventilator, you are on continuous sedation. That means you are not unconscious, but we've given you medication to a point where you are kind of like, I would say drunk, which is probably not a right terminology, but I think a lot of people can relate to that if they've been drinking before. So you don't care about what's going on, right? Although you are like, but you are not to a point where you are touching stuff and moving stuff, right? So if you trigger a breath, once you trigger a breath, the ventilator itself can sense it based on the setting that you were put on. So we have one setting called the pressure support ventilation. That means the ventilator setting works if you are not breathing. The first time you take a breath, the ventilator is going to cut itself off for a couple of minutes or maybe some seconds to see if you take another breath. If you don't take another breath within maybe 8 to 15 seconds, then it will kick back in and work again. Right. So that's just one setting. So there's a lot of protective gears and things put in place. So you're not going to see people going crazy and throw
see a lifetime.
It's not going to happen.
That's good to know. So tell me, this is so complicated. So when you think about the whole ventilator use, and I know that when COVID came out and they talked about COVID management in Ghana, they mentioned that there was really a lack of ventilators. So how do you feel about that in terms of, let's say someone really, really needed this to be able to live? What would happen if we couldn't be able to intubate and have someone on a ventilator?
So the reason why we protect your airway and to be able to give you oxygen, right? So there's two markers that we use. It's a couple, but the main markers that we use to see if someone needs ventilation is the marker itself. That means their oxygenation level is low, right? So you have them on a simple pulse ox or something that measures the oxygen level in their blood, and you can see that in percentages, right? So 100% is great, right? So we say everywhere between 90 to 100 is what we want. Okay. And you can see that's a very, very simple measurement. You can plug it on anybody's finger and just watch them. So that's one marker. So you look at a person and you see they have a problem breathing. So eventually you see their oxygenation level drops. So they go from 100, 95, 90, and maybe 80. Now, what anything below 90 means is that at this point, your brain is not getting enough oxygen.
Okay.
So that's the first marker. The second marker is if your carbon dioxide in your body itself increases, right? So CO2. So your lungs is compromised. When you take in oxygen, you give out carbon dioxide, right? So if your lung is compromised, when you take in oxygen, you're not going to be able to give out the carbon dioxide, right? It's not exchanging. So the carbon dioxide in your body itself increases, which leads to a whole lot of problems for not just your brain, for other organs, right? And that itself is why people get very confused and they eventually pass out because it's so high, right? So those two markers tells us that if this person is not intubated or given some type of oxygen invasively, they're probably not going to survive within minutes. Okay. So now let's take that to a place like Ghana where they don't have ventilators, right? So if you have a patient in Ghana in a place that's, exhibiting the symptoms and the criteria that I just talked about, and you don't have the ventilators in place or someone that can intubate and have the right equipment to intubate someone, then unfortunately you're going to end up losing a lot of people. And it's happening, even happening in the United States when COVID first started, that people were dying for lack of ventilation.
Yeah. Would you say it's changed a little bit? Because I feel like when COVID first came out, the main concern, even from the government standpoint, was to make sure that we had enough ventilators. They really, were going straight forward. But as time has changed and as we've been evaluating COVID, because remember, COVID is new, so we're all learning. Every specialty is focused on learning how COVID is affecting the body. I feel like less people need ventilators, but every so often, when we hear about those cases that need ventilators, unfortunately, they always come back with pretty poor outcomes. What would you say about that?
So when COVID started, we were all confused in the healthcare system. We didn't know what it was. Well, first of all, it took a while to even know what COVID was, and then try to formulate how to treat it. Approach the disease was also difficult. It kind of took a while, right? It wasn't immediate at all. So as far as lungs management or pulmonary management, immediately or right when it started, okay, we said, well, if someone cannot breathe, we have to put a tube through their throat. We have to breathe for them. The therapies at that time was not the best therapies, right? We didn't know how to treat the disease itself. So putting a tube through somebody's throat, yes, you protect the lung, but the disease itself can kill the person. So what has changed now? What has changed now is that there's better therapies in place, right? So if you get COVID and get to the hospital and get sick, the treatment is very focused, is very fast. So your chances of getting very, very sick is very low now, or the risk is very low versus, let's say, March of 2020.
I agree.
And for that reason, the intubation itself is lower, right? And actually, I was on a panel where they were talking about now also there's other ways to actually reduce intubation. You don't have to intubate anybody. So if someone cannot breathe, maybe you put them on their belly and give them oxygen that way. Maybe, there's other ways that you can maneuver the person to kind of avoid the intubation itself. Okay. Right. So now, so you say that the outcome is poor. So if someone is needing intubation now, then the therapy really is not working to a point where they're. So the people that actually get intubation possibly may have a higher risk of death than the people than before. But so I think that's what's happening now. So intubation is low. There's no more shortages of ventilators,
which I did see, which is a blessing, because that was scary watching the news every morning and saying that, oh, we don't have enough ventilators. And you think about America having almost everything, right? So we're worried about our people back home, not having it. And then you turn on CNN and they're like, oh, New York is short with ventilators and everything else. So that was a very scary time, I would say, COVID. Absolutely. We're going to take a quick break. And when we take a break, I'd like to show a very amazing video of Dr. Otis in his working environment from the Navy. Please stay tuned and we'll be right back.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
It's thrilling to be able to save lives and interact with your fellow sailors and know that you're there for them. The sky's the limit as far as your leadership potential as an officer. You can be a department head, you can be a division officer, be the director of surgical services.
So my job as a Navy nurse is to take care of critical patients during their time of need.
The Navy has given us a lot of training. Were we to deploy together, we can work together as a team and adapt as we need to at the right time.
As a perioperative nurse, my main job is to keep the patient safe. I assist the anesthesiologist with putting the patient to sleep.
I'm a certified nurse anesthetist. I'm the only one on this ship, so I'm here primarily for trauma surgery, things that needs to be done to save lives. I do a lot of dental cases, teeth extraction, I do a lot of sedation. This is probably 1/4 the size in a civilian operating room. It's me, a surgeon, and a tech. I am responsible for a lot.
The Navy sent me to midwifery school, and I received my Master's of Science in nursing with a specialty in midwifery. A lot of our military family members have to have babies without spouses and have to go it alone and we're their family. There's nothing like seeing a mother meet her baby for the very first time, put it into her arms, and seeing a new life begin.
I was tasked to go to the Comfort to help the people in Puerto Rico I basically helped provide aid to multiple situations where people needed to be emergently intubated, had to have life-sustaining measures as far as doing CPR.
You have to love the people. You have to have compassion.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Tuned for this evening's edition to Health Talk. Let us take this time to just really give a congratulations to everybody in the military that is serving. It is very important for us to respect everyone who is in the armed forces, the Navy, the Army. We really respect you all, and we thank you for all your courage and your protection of our great nation. So thank you for that. Let us go to our feed and read any of the comments that we have. So I can see here our president, Mr. Pakwesi Sam. He is the president of the Ghana National Council. He said, "I love mobile doctors. They are cool." Thank you, Pat, for your input. Shay Akoto says, "Looking good, big brother Otis." Okay. Empress, who is the normal host of the show, she's unable to make it today. She's just encouraging everyone to share the feed. Ibrahim Muhammad, he's a normal person who always supports our show. He says that he's very enlightened tonight, just that he feels much greedy because particular people in Ghana ought to be watching and listening, but unfortunately they're sleeping. So the good thing about this is that it will be available on YouTube. And so you can always find us on Trend Africa TV. You can find us on Ghana National Council and be able to catch up on whatever you missed out. So thank you for that. And then we have a message from Hannah Nunu. She's my lovely sister. And she says, "Very informative. Good job, Eunice. Thank you. And God bless you for tuning in." If anyone has any questions or concerns, I just want to give this opportunity. Please put your questions there. Dr. Otis is here to answer any questions that you may have. We want to go ahead and talk more about the vaccines. We're waiting for Dr. Ofori, who is the pharmacist who's always on our professional panel. Unfortunately, he's not here yet. So we're going to wait for him to come, and we'll go ahead and dig deep and see what's going on with our vaccinations. But Dr. Otis, how do you feel about the vaccinations? Have you received the vaccination yourself?
Actually, I was in line. I was in line to get the vaccination the first day it came out. So the line was too long, so I got it the second day it was out. Do I believe in the vaccination? Yes, I do believe in it, right? So the pandemic is not something to take lightly, right? We have scientists and people that work in the hospital that went through a lot of quick research to help protect the world, right? And they came out with this amazing vaccines that works, right? So if you look at the numbers of the vaccines that came out, there's not a vaccine that's 90%, right? People forget that the flu shot that they get in line to take every year is sometimes 50%, sometimes the best is like 60% protection. When you have a vaccine that's 90%, that's gonna keep you from dying. Now, for some of us that work in a hospital that has actually witnessed people die, right? You talk to someone that has COVID, you just talk to them like 6 o'clock in the evening, and they're doing fine. They tell you where they're from. They just can't cough in a little bit. They can breathe. They're talking to you. They don't know what's going on, but they're doing well, right? And then you get called 6 hours later, midnight. Then you have to put a tube through their throat. And then the morning, they are not alive no more, right? To me, if there's a way to stop this from happening, that trend, and the vaccine is going to do the job, then absolutely, absolutely, I believe in it. And I think it's a good thing. I think it's definitely a good thing that's happened.
I agree 100%. I think there's a lot of fear amongst everyone to get the vaccine. And I get it because it did come out pretty quickly. But as you said, I am a strong believer in science. And I do believe that everyone worked tirelessly because they were really tired of seeing the increased death rates. And so now that we do have vaccinations, I encourage everyone to get vaccinated once it's your turn. In Illinois, you can go to walgreens.com and actually sign up to get a vaccine. I also learned on the internet that Jewel Osco was also offering vaccines. So please make sure that you're getting vaccinated, especially our vulnerable population, right? We've talked about that a lot on this show. People who are over 65 and have comorbidities. That would include hypertension, diabetes, asthma, things like that would make it more difficult for you if you were to have COVID-19. Now, COVID-19 in itself, a lot of people, they watch the TV, and unfortunately, we've heard a lot of times from the president that it's just like the flu, it's like this and that. But everybody really reacts to COVID-19 very differently. And that's what I really want our viewers to understand, that maybe you're going to have it and only have that loss of taste for a couple of days, or, have those mild symptoms. But as Dr. Otis explained to us, there are people who are in the hospital who have to be intubated. That means they have to have a whole airway breathing for them just because of this virus. So that should encourage you just the more to wear your double mask, wash your hands appropriately, use your hand sanitizer. Don't be selfish, because we need to protect each other. And that is the reason why the push to get the vaccine is really on. President Biden is making sure that everyone has the vaccine. So if you have access to get the vaccine, if you are offered the vaccine, please take advantage of that and get the vaccine. Please do, because it's a very serious disease. We've been dealing with this since March, and I just worry about the children not going to school. And life has really, really changed for all of us. But the only way we're going to get to some type of normalcy is to take the vaccination so we can move on. How are your kids doing with homeschooling? Or are they back in school? Are they doing hybrid? Because I know they give a lot of different options.
Actually, for my household, my wife and I decided to completely switch to homeschool.
Okay.
So we took our children, our two kids, 7 and 5, out of the public school, and my wife has been doing an amazing job homeschooling them. So they're not in the public school system no more.
Okay.
We did that for us. It worked for us, of course. For my wife, she does an amazing job. It's something I can do, and she's also home, so she's able to cater to these kids' needs educationally, and and it worked out for us. Now, as far as we were part of the distant schooling, the virtual schooling. Okay. It was very difficult, and I'm pretty sure it's very difficult because I used to say that the kids are on the virtual screen for about maybe 2 hours a day, and the parents do about 8 hours a day of work with them.
Very true.
So that was extremely difficult, right? So, I feel for people that are still in that system, and I can't wait for the kids to go back to school.
Yeah. It's hard. And I recently heard, I don't know, what state are you in, Dr. Otis?
I'm in Maryland. So I'm
Maryland. So here in Chicago at the Lurie Children's Hospital, they just started a new research, and they are looking to see how children react to the vaccine. And I think that is a very, very good thing, because as it stands right now, and Dr. Ofori is joining us, so he'll be able to give us some more information, but I believe the vaccine started at age 16, if I'm not mistaken, right now. So Lurie Children's Hospital is looking to see how children will react from ages 3, I want to say from like 3 to 15, which really, really helps a lot, because I feel like if we can get our children vaccinated, that's going to be easier for the teachers to feel comfortable to come back to school. And then we can be able to have kids back in school. I personally agree with you. Virtual schooling for my 14-year-old, I'm back in school, basically. It's a lot of work. I'm learning things all over again, algebra, and it's a lot of work. So I am eager for the kids to go back to school. However, I want us to do it safely, so that's just the way I am right now.
Yes.
We're going to take a quick break. When we come back, we'll be introducing Dr. Edward Ofori, who is always on our panel. He's a pharmacist, and he's going to be giving us the updates on the vaccinations, including exciting news that's coming from Ghana that they have received their vaccinations. Please stay tuned, and we'll be right back.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back to Ghana Month and the Health Talks on Trend Africa TV. We are now joined by Dr. Edward Ofori, who is an assistant professor of pharmaceutical sciences at Chicago State University. He is a pharmacist by training. His research focuses on drug discovery with neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. Dr. Ofori, you are more than welcome to the program. Thank you for joining us once again. How are you doing?
I'm doing good. Thank you. Thanks for having me.
Thank you. So go ahead. We've just been talking a lot with Dr. Otis. He was telling us all about the intubation and the ventilation for patients, and we're just running right now for you to give us more information in terms of the vaccinations. I did see on the news that Johnson & Johnson has gone ahead, I believe, and got approved and being rolled out. So if you could give us that information about Johnson & Johnson. And then, of course, everyone is eager to know about the vaccine that reached Ghana. I've seen some very funny things online with people getting it and they're freaking out and all this other stuff. So it's good stuff. And so we've been waiting for you. So take it away and let us know what's going on with treatments and vaccination.
All right. Thank you, Eunice, for all the great job you've been doing, educating people. So on the line of vaccines, like we always say, that's what we've been hoping to get to help us combat this pandemic. We've been fortunate enough to have a third vaccine that has received emergency approval for use in the United States, which is the Johnson & Johnson vaccine. And again, it's also a genetic vaccine, but then it uses the adenovirus platform. And it's a single shot vaccine. Even though its efficacy is not in the 90%, it is equally good in the sense that it prevents 100% hospitalization and possible death from COVID, which is great news. We do know that around the world, the trial was done in about 3 different areas, and the efficacy was, kind of segregated based on where the study was done. We know that all over the world if you put everything together, it's about mid 66% efficacy. You have about 80 something percent in the United States. And even when you go to South Africa, where you have the B1351, there's a reduction in efficacy, which is kind of explains why we need to roll all these vaccines out so that we can beat the virus mutation in that regard. Hey, the good news again is we have one more vaccine production. Johnson & Johnson is teaming up with Merck to increase or wrap up the number of vaccines that we're going to have to the extent that we could actually get to our goal before the set time, which is great news. However, I'm still worried about the rate at which the rest of the world is getting vaccinated. Great news is that Ghana was the first country among the list of countries in the COVAX to actually receive, I think, 600,000 doses, which translates into, a very tiny fraction of the population. But then it goes a long way. It's just the beginning of a lot of vaccines that will come to Ghanaians. However, we are worried about the vaccination itself, right? So I always say that it's not the vaccine that will take us out of this, is actually vaccination. So we need to do a lot of education. We need to explain it to a lot of people to kind of bring them to speed with where we're going with this vaccination that we're going to have in Ghana. And it's exciting. As you see on social media, a lot of people are getting the vaccines. The distribution of the vaccine in Ghana is mostly informed by how endemic the disease is. Accra, Kumasi, and I think Takoradi and all these places that have a lot of cases are going to receive those in certain districts. Of course, about 40, over 40 districts will be receiving these vaccines.
So let me ask you. I learned that if you already had COVID-19 and you want to get the vaccination, you have to wait for 90 days. Is that accurate with the Johnson & Johnson? Or what if someone is just afraid and doesn't tell anyone about their prior COVID status and goes to get the vaccination? Would that cause any problem with any of the 3 vaccines that are out right now?
Ideally, it will not cause any problem. The most important reason why they're asking folks who already had prior infection to wait is that, there's limited amount of vaccines, right? And if you ever had infection, at least research has shown that people who had severe infections have up to 5 months protection. And therefore, we will prefer that if you had prior exposure, you will wait 90 days in order to receive the vaccine. That's number one. Number two is that there's some studies that have shown that some people either react to the virus itself or even the the antibodies that they develop when they get the shot. And you see that with the 2-dose vaccines as well. When you have the first shot, the second shot, you feel really sick, right? We still don't know if there's any correlation between the two, where if you had a prior exposure, given the vaccine, which produces almost the same, I would say, immunity, but then the person who's exposed to the virus itself tend to have both the cell-mediated and also the antibodies as well. So we don't know yet, but then we advise that if you've ever been exposed, you wait out a little bit so that you can save the dose for somebody who doesn't have protection at all.
I see. Right now with my job, they've been telling us that we should order the antibody test for people to kind of see their past exposure. Can you explain to our viewers what that means if you were to get your blood drawn and check for antibodies of COVID-19?
Right. So getting, and that is a seroprevalence study that was done, I think even in Ghana and a lot of places, is that we can actually check your blood to see if you already had prior exposure. However, we realized that the amount of the antibodies actually starts reducing with time, right? So the levels might be undetectable by whatever technology you're using to detect those antibodies. And the antibody testings that they are not as accurate, or they are not a gold standard for detecting infection or something like that. Since you know that this pandemic has been in existence for more than a year, and we know that the antibodies actually starts leaving your body after some months, there could be that somebody already had a prior exposure, but wouldn't indicate that they have those antibodies and can actually get reinfected. So yes, it's a good tool to add to the gamut of tools that we're using at this point. But we should exercise caution when it comes to using antibodies as a way to trace or track or to see if somebody actually got exposed. The best way is to do the PCR test if someone has recent exposure. If they do show positive tests for the antibodies through the antibody test, that's good too. That gives us an idea that the person has a prior exposure, and you can probably have a better chance waiting out to receive a vaccine later. But it doesn't hurt to actually get a vaccine, even if you have antibodies, because the whole idea is to boost up the levels of your antibodies so that you can have elongated protection with COVID. And even now that we're having different strains, there's even talks about potentially having booster shots later on in the course of this pandemic.
Like the way we have our Tdap every 10 years.
Yeah,
another
that's
vaccine.
true.
You know what I find very interesting, and I'll put this both out to Dr. Otis and Dr. Ofori. I feel like we've all received a lot of vaccines, right? Even when you want to travel, you go to the travel clinic and they basically look and say, "Oh, you're going to Ghana. Let me give you rabies. Let me give you this, that." And we take these vaccines. But why do you think there's so much of fear with the COVID-19 vaccine? I mean, everyone seems, some people are not afraid. They're showing us on social media, but there are also people who are very, very afraid. There was actually, I believe, a movie actress who came out in Ghana and, explained very in depth why she was not going to get the vaccine because she felt like there was not enough research. So why do you think in general people are so afraid? Especially, I hate to say it, but Africans do receive a lot of vaccines.
Yeah, that is true. I know. I think today's world, we can blame everything on social media, right? The way they rate that information spreads around the world is very fast. So good information goes fast, bad information goes fast, right? So I think when the pandemic happened, there was fears that was spreading, some type of miseducation about what the pandemic really is. So, people had stories that backed it, that it was actually created to subdue or whatever it was to mankind. And for that reason, the same population or the same people also believe that maybe there's a vendetta or some type of agenda behind the vaccination that's also going to put them in the same corner. I think it's just a miseducation, misinformation. Some few people don't take the flu vaccine, right, for various reasons. But like you said, we've taken it. When you have a baby, Today, I was in a hospital. I work in the labor and delivery. We delivered about 3, 4, 5 babies. You know, out of these babies, all of them got some type of treatment, right? When they were born, the mothers did not say a word, right? They didn't ask how long the research was done and who did it and what are you giving to my baby. They say, oh, can I do this? Go ahead, all right? I think just misinformation.
I agree. What do you think about them making mandatory to be able to travel with the COVID vaccine? I heard, I believe it was on CNN, they said that the government is trying to make it mandatory that if you need to travel, you need to show proof of the COVID-19 vaccine. Kind of like the way you need like a yellow fever card, right, to enter Ghana, where unfortunately I have heard from some people that they weren't asked, but I feel like whenever I show up at the Ghana airport, everyone asks me for my yellow fever. So I've always had mine. But what do you think about that? Should it be mandatory or should it not be mandatory?
I think Dr. Ofori, you take this one.
Right. There's no way they can force you to do it, just like any other vaccine, right? No one is going to point a gun at you and say, hey, you got to take this vaccine. However, it's in the interest of public health that we usually advocate people, advise people to take these vaccines. Looking at how COVID has actually devastated the whole world, pulled everybody to a halt, I think it is in order that we will actually enforce these kind of things, especially with travel, that if you have the vaccines available to you right now, not everybody has it. Only 8% of US population has actually vaccinated at this point. US is one of the richest countries in the world, and it's only have 8%. So right now, enforcing those kind of rules will be a little challenging in my opinion. But however, going down the line from extrapolation, it will take, I think, close to about maybe 6 months or so to get everybody vaccinated in the US. In the world, it would take the rate at which you're going, it would take us 5 years to get up to 75% herd immunity or some kind of vaccination. That tells you a lot, right? So in a way, they can enforce some of these rules for travel because of how variants are, we're having different variants and how it's going to be a little bit challenging, to control those kind of variants from different places in the world. I think it will just be in the interest of public health to restrict travel to certain areas if there's certain strains that are detected, or you have the latest vaccination like we do with all other vaccines.
And speaking of restricted travel, let me bring to mind to all of our viewers that Ghana is still a Category 4, according to the CDC, and they are encouraging people not to travel to Ghana unless there is something very, very serious that you need to go for. Which is hard for all of us. I feel like the way they gathered all the Ghanaians to go to Ghana is they had really cheap tickets, right? So everyone looked at the tickets and they thought, oh, I'm going to go there. But I do want to make sure that our viewers are aware that it's just not a safe time. I think as Ghanaians are getting more vaccinated, probably the CDC will probably loosen up a little bit. I feel like some of the restrictions they had, even though we heard the president was saying it, unfortunately, when you speak to people, those were not what was really going on. For the longest time, I heard the beaches were closed, but then I spoke to a few people there and they said, oh no, the beaches have been open. So I think a little bit of miscommunication, and both Dr. Ofori and Dr. Otis are both in positions where they can educate the public. So I'll start with you, Dr. Otis. What do you plan to do in terms of even being the vice president of AGAPNA? How do you plan to really educate people so they can be able to have confidence in the vaccine, both here and in Ghana?
So what we do now, like you said, I believe in science. If I don't believe in science, I should not be in anesthesia, right? Everything I do is highly researched. As a matter of fact, some of the medications I use, they're rotating very quickly, as Dr. Ofori probably will attest to that. Anesthesia medication, if you don't keep up the research, next time you know what you've been using last year, it's no longer the right medication to use, right? So we believe in research, and the same people that do this research that gives us these medications to give you when you come to have surgery are the same people that are doing the research to come up with these amazing vaccines for you. I will say that I think that there's a distance, right? If it never happened to you, you don't care. And I think that's the way people look at it. So if you think about it, for us in the hospital, like I mentioned before, it's easy for us to get a vaccine, but we've seen it. I mean, I've seen someone that I know who's a doctor in the hospital died, right? Yeah, treatment in the same hospital in COVID and passed away. So I've seen the detriments of COVID itself. And if you haven't seen that, it's very difficult to say that I won't take it if it hasn't happened to someone that you know.
Right.
However, we have to educate our friends, not just, our friends, our brothers, our sisters, the people that we work with, encourage them to take it. I always tell people, look, I took the COVID vaccine the first time it came out in December. Okay. I still have all my fingers. I still have 5. I haven't grown the 6th finger. I'm thinking clearly. I'm still doing my job. I'm healthy. So I don't think if you are afraid of it, I'm your research. I'm your guinea goat. Okay. I'm a guinea pig. Guinea pig. Use me. All right. I'm still alive. Go and get a vaccine. I did a test for you. You won't die. Right. So that's what I would say. So there's continuing education on the side. I know that Gambia has been involved. Right. So we were involved right away. Association of Ghanaian Advanced Practice Nurses Abroad when COVID started. So we actually immediately raised funds to support the Ghana Embassy in their efforts to kind of deal with COVID in Ghana, which was done successfully. We were able to support that right away. And we also sent COVID protective gear to a hospital, a clinic in Ghana that we partner with to kind of support them because they don't have the resources and to cater for the community that they're involved in. So Mangwaze Hospital is one of the hospitals we have adapted to kind of help and support their efforts in treating the community. We've donated things to them like gloves, respiratory things, and stuff that can help them take care of COVID. And we continue to do so with them. Why? Because we want to stretch our hands to educate and help people with the skills that we have, our clinical talents, I call it.
Absolutely. And once again, that is AGAPNA, and we are calling out for all nurse practitioners and nurse anesthesiologists to join our platform. You can visit us on Facebook and Instagram, and please join us. It's a wonderful organization. And like Dr. Otis said, we are committed to helping our people back home and people here in the United States. So thank you. Dr. Ofori, you also have a platform that educates people. So how do you plan to really increase knowledge for people to just feel comfortable with the COVID vaccine, or even the 3 vaccines now that are approved in the United States? What can you do to make sure that people feel comfortable enough to take the vaccine so we can be able to get to our herd immunity?
Yeah, so I have 2 different platforms, and including this one, of course, that I try to reach as many as possible people in terms of like educating them about COVID, period, because people still think, and even in the United States, people still think COVID is not real because they haven't seen anybody get it. Just like Dr. Otis was saying, you need to educate people, let them understand, because a friend of mine's mom called and was hesitant about the COVID vaccine, right? And then he actually educated, like broke it down, all the questions he had, he was able to provide answers to it, right? And then at the end of the conversation, the lady changed her mind. That is an example of how education changes people's mind. When they have questions and they are not able to get the answers from experts, but then they get it from conspiracy theorists, then we have an issue. That is the reason why our organization, which is Health Info Africa, we do like an update or kind of a show every Saturday just to educate people and answer questions about COVID and other health issues. The whole idea is that scientists like Dr. Otis, myself, and you, Eunice, like we understand our language, right? And we go out there, we do the research. I'll go sit in my lab, cook those drugs, never communicate anything with the rest of the world, right? And then out of the blue, hey, here's an injection, take it, right? And then the question is like, the last time I took it into Tuskegee, it wasn't good, right? The last time you did an experiment on me. So there's a historic perspective. I think we still lost the people that we actually give these agents to, or drugs or vaccines or whatever to. We don't involve them in the conversation. So a lot of the time, there's a lot of questions between, how did you come out with a genetic vaccine? It's actually going to change my genetics. And they have every right to ask you that because you never explained what genetic vaccine was in the first place. So in my opinion, the whole idea about education is that we are actually behind, just like the way we are catching up with COVID. We are already catching up with conspiracy theorists. Everything that we've seen about COVID, there was a corresponding conspiracy theory that actually spread more than the facts. I have a lot of people forwarding me videos because they know I'm a big advocate of education. They send me all kinds of videos and I listen to them, right? Because you want to see how people think. Because when I'm over here speaking facts, people don't want to listen to. You can see how many people probably watching our live right now. But guess what? If it was something very interesting, maybe you have 1,000 people watching it. But what I'm trying to say is that it's your health. It's in your own hands, right? Make sure you wear the mask. Make sure that you get a vaccine. When the vaccine is available, you get it. Because at the end of the day, it's up to you. There's not enough ventilators in Ghana. The healthcare system is as of 3,000 cases, Ghana's system got choked, right? So now we're talking about you're almost in 10,000s of cases.
Yes.
That is not looking good, right? So, and our positivity rate hasn't come down below that 5% that the WHO is looking at. And that's the reason why we're in that category that you mentioned, right? So we are not doing well, and the quality of people dying is even worse, right? So I'm advising that, hey, we have Trend TV Africa, we Trend Africa TV, we always educate people. Health Info Africa, we do that. I go on ACO Radio, try to get people to answer questions and things like that. That is the only way forward. Otherwise, there will be millions of vaccines in Ghana, and we'll be sitting there. We have to pass it on to another country.
Very true. And the vaccination that actually reached Ghana, I learned that they don't have a temperature requirement. Is that accurate?
That is true, because that is the AstraZeneca platform that was used. So they teamed up with the AstraZeneca India to get those vaccines into Ghana. But the temperature requirement is better than you have with Pfizer. You can actually store it in normal refrigerator temperature. Keep it out for hours, and it will be fine for, I think, up to 3 months storage, and it's fine. You don't get that with the Pfizer and the Moderna. So in a way, it's best for our area. It doesn't mean that we are reserving the West for these. And I always want to clarify that people think, or when you say, oh, this is for Africa, then it means you have something ulterior about it.
Right.
It's just our system is not set up for those, minus 90 degrees kind of distribution. And therefore, this is the best option for Ghana.
I agree completely. And is the AstraZeneca vaccine, is it 2 parts or is it only 1?
No, it's only, you mean the doses?
Yes. Do you have?
Yeah, it's 2. It's 2.
Oh, it's 2. Okay. Is it the same time frame? I know Pfizer, I believe, is 21 days. How many days in between is the AstraZeneca?
AstraZeneca, I believe, is after 21 days, but I'll have to check on that number for you. But I mean, the whole idea is that even with Johnson & Johnson, they're still trying 2 doses to see what will come out of it. Because the more memory cells you have, the more antibodies you have, the better your immunity is going to last. So even though we have a 1 shot which can do the job, they're still investigating 2 shots.
Okay, got it. And Dr. Otis, I've heard that some people have actually went into anaphylactic shock after receiving their vaccine. In your role as an anesthesiologist, have you seen anybody who has gone through that? Has anyone needed to be intubated or put on a ventilator after receiving the vaccination?
No, I haven't. I think I would say that there's very few cases, and most of the cases that came right after vaccination, we all saw it on TV. So that's how small the numbers are. Right?
Yeah.
A lot of people get anaphylaxis after that. I think there was 1 case of someone that got anaphylaxis, and there's few cases of some type of allergic reaction after the vaccine. Now, to put this into perspective, and Dr. Ofori maybe be able to touch on that, I have actually intubated someone who took the flu shot and got anaphylaxis, right? Not anaphylaxis, but reaction, right? So Guillain-Barré disease is when your nerve endings start losing sensation to your muscles, where you immediately become paralyzed from that. So there's a risk of that. Now, so there's risk with everything. Everything has risk. But then when you look at how many vaccines is being given, even if let's say it's in the millions now. So if you want to take risk and say, oh, I know someone that showed up on TV and they have anaphylaxis, even if you can count 10 people, that's a very small number, right? Based on the general population, how many vaccines are actually been given already, So I have not been involved. I don't think anybody that I know in anesthesia has been involved, but the numbers are on TV, so that's how small the numbers are.
Very interesting. Wow. And so you said that you had to intubate someone who had the flu vaccine. That's kind of severe. Someone had the flu vaccine and had an anaphylactic shock that was that severe?
Right. So the flu vaccine has the virus itself had some type. You can have some type of nerve damage. Well, it's not a damage. It's just a syndrome that kind of associated with the flu vaccine. It's very rare, also. But I just mentioned that because even that I've seen, even how rare that is, I've seen once in my life, right? Mm-hmm. In what I do as a profession, and that's a very rare disease, right? So with flu, we take it all the time, and we don't think. Right? It's like, oh, yeah, so you line your case up, right? The coronavirus vaccine itself has actually proven to be safer as far as what we know now and side effects compared to the flu already. Wow. All right. Most people, I got sick the second time I took the vaccine for half a day. I got some type of feverish. I was in my couch watching TV with a big old blanket over my head. Shivering, right? So that's the side effect, and most people got that side effect, right? And the next day, everybody reported being well. So the side effect is very minimal. It's very extremely minimal. Extremely minimal.
And Dr. Ofori, how important is it for people to report their signs and symptoms? When I went to go get my vaccine, they gave me some paperwork and said that, Eunice, if you discover any symptoms or anything, please let your, the CDC know or your national service know. Could you explain to our viewers how important it is? Because I feel like as Africans, sometimes we like to hold a lot of things in. But when you think about research in a whole, right, you don't know anything unless people report it. So could you just touch on that a little bit, how important it is to let people know exactly what symptoms you are exhibiting after getting the COVID-19 vaccine?
All right. So I'll start off by saying that all the vaccines that have been given up to date before even these genetic vaccines came, the research that they did show that most of the side effects, severe side effects, actually showed up 60 days after they received the vaccine. So part of the reason why when the trial was going on, they allowed 60 days to elapse before they start monitoring some of these things. So it's been, since we started inoculating people, it's been more than 60 days, right? So like Dr. Otis said, we haven't seen much bad side effects that is like out of this world kind of side effects. Most of them are tolerable. You get a little feverish. I took the second dose and I felt a little sick, just like the same way he described it. Most of people are getting the same similar effect, which is what we call reactogenicity, right? Your body kind of reacts to it, your immune system, and then you feel a little bit sick. However, they give you the option to report any unusual signs and symptoms of people having an anaphylactic shock. I read in Medscape that some people actually have inflammation of a lymph node under the armpit. Some people have pain that lasted a longer period of time than usual. These are all symptoms, or I would say side effects that you want to alert your health professional, wherever you got the vaccine from, so that they can document it, right? Because this is new. Part of the reason why people are skeptical about it is because, some people think it was produced too quick. Some people think maybe it wasn't thoroughly vetted. It was politically motivated, a whole lot of stuff, right?
A lot of theories.
Yes. And people are spreading a lot of news about the vaccine that it will make you grow extra fingers and nipples on your head, all kinds of stuff, right? But none of that has stood the test of time. And that is the reason why we believe in science. We do test. If you claim that something works, just do a trial. Give people a placebo, which means just give them water pills and give whatever you think works and compare it. And then you see the difference clearly, right? So to me, we should report any adverse effect that we see. And not even with vaccines, okay? Let me put this out there. Even with ordinary Tylenol.
Yes.
If you took Tylenol, any drug that has been used for years, and you kind of have any side effect that is unusual, there's always a hotline to call. I don't have that number right now, but there's always a hotline to call to report these kind of incidents.
Very good. I think that's wonderful. We're going to take a short break. When we come back, we'll be wrapping up, hearing our closing remarks, and we'll also hear a few announcements from our community. Thank you so much for tuning in, and we'll be right back.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
Internet is so much fun, I know. Corona is trending fast, I know. Some are scary, some are funny, others too fake news. Then don't share. Why not go to the right place for Corona news? Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UK Aid.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back, and once again, thank you for staying tuned to the Health Talks on Trend Africa TV. We're going to go ahead and read some of our comments. Ibrahim Muhammad says that, I'm watching live from Kumasi. Some people were much concerned about how 600,000 doses of the vaccine can be shared by health workers, top politicians, and at the same time serve some old age Ghanaians. They suspect that the government has secretly brought some in Ghana without Ghanaians knowing. Well, I will say that one thing I just want to say for our disclaimer is that we are not political by no means. All of us here believe straight on research and facts. So I don't know what the government did. We really don't know, but we are encouraging everyone who has access to get the vaccine, whenever it's your term to be called, to please go ahead and get the vaccine. Dr. Otis or Dr. Ofori, do you have anything to add to that?
No.
Thank you for your comment. We really appreciate your support. He always supports our programs. We have 4 questions from Benjamin, a very nice gentleman that I was actually able to work with when I was in Ghana myself. He says, first of all, thank you for a wonderful program. God bless you, Benjamin. Thank you for joining us. And he has a few questions. First questions is, what are the complications of intubation and how do you minimize them during the procedure? Dr. Otis.
So the complication of intubation itself. So what I would tell you, to place a tube in your mouth, there's chances of chipping teeth, putting abrasion on your lips, or sore throat. Now, this is intubation for surgery. So we're not going to talk about intubation. So something I'm going to place a tube into your throat, and then we're going to do a 2-3 hour surgery. And then at the end of the surgery, I'm going to wake you up and remove it, right? So immediately there's risk of some type of abrasion on your lips because, I have to maneuver your airway or your mouth to place a tube and chipping teeth. Also, there's risk of lung disease, right? So the risk of infection, anything that goes from outside, the outside environment to your airway or your trachea can transfer some type of bacteria, right? And then so that leads to risk of pneumonia and things like that. There's also risk of aspiration, right? So you can things in your stomach can come out and go into your lungs while you are unconscious because you cannot protect your lungs. Or, when you are conscious, when something tries to go into your lungs, you cough it out immediately. Okay. When you become unconscious, you cannot cough it out. So what do I do to prevent that? These are some of the risks, right? So first of all, I go really slow and gentle to make sure that there's no abrasion in your lips. Make sure that your teeth is not going to be chipped. So during the intubation, I use a laryngoscope, an instrument that I use, and then I will lift your upper palate, so your upper mouth up to open your airway so I can see directly into your windpipe, and I'll place a tube that goes in there. So that chipping teeth is involved, right? So I really go slow. Look at the teeth, the way I maneuver this instrument, that your teeth is intact, and that doesn't happen. Now, sore throat, there's a couple of things we can use. We can do like a lidocaine spray to numb your airway. Sometimes it works, sometimes it doesn't work. You know, and sore throat is probably one of the things that half and half, right? But if it does happen, it goes away within about 24 hours after the tube comes out, just irritation in your throat. Now, as far as pneumonia, which is like a higher risk, right? And also aspiration, if that happens, then that's a true risk that can cause a lot of problems. People can actually die from that. So first of all, before I place the tube or when you come for anesthesia, the day before, we're gonna tell you don't eat after midnight, right? So the notion is that your food, if you had a full belly of food, then at 12 midnight, by the morning, maybe 6 or 8 hours later, the food is all left your stomach. So your stomach is empty. Now it's in your intestines. So when you come to me, the chances of food actually coming from your stomach is very, very minimized, right? And then drinking water is the same thing. And also I can do a procedure where I put pressure on your trachea itself. So your windpipe here, I can put pressure on it to kind of put pressure on your esophagus to decrease the risk of food coming out of it into your lungs. So, and that's how we do it. And we also, the procedure is not sterile, but we keep the tube so clean that there's no chance of infection, some type of bacteria on the tube itself before it goes into your windpipe.
Thank you very much. And our second question from Benjamin is, and this would go to Dr. Ofori, if half of the population in the world receives the COVID-19 vaccine, how long will it take for us to achieve herd immunity?
All right. So if I understand the question is how long?
Yeah, he says if half of the population in the world receives the COVID-19 vaccine, how long will it take for all of us to achieve herd immunity?
Yeah, so that's a very good question. I mean, as we speak now, like I mentioned, the whole world, if you go at the same rate of vaccination, it will take us 5 years to get to 75%. And I know that number is going to change as time goes on because more vaccines will be approved. We don't aim for 50% because, we are having variants that are actually spreading quicker, right? More transmissible. So we are looking for 80-something% at this point. So we want a lot of people to participate in the vaccination. That's the reason why we are focusing on the education piece, because now, like in Ghana, we say, Eja is here, right? Which means we've been looking for this vaccine for so long. We now have it. What do we do with it is actually the most important part at this point. So it's not 50% we're looking for. We're looking for at least 70-something% of the population getting vaccinated. It will take longer if you actually don't increase the rate at which you're vaccinating.
Okay, and he actually has 4 questions. We'll go to his third question. Excuse me. Is there anything Ghana Health Services and her agencies can do to convince people to take the vaccine? And how do we do away with the misconceptions? And Benjamin, I don't know when you joined the program, but we did address that, and we all, we are all committed to education, right? So Dr. Ofori talked about his platform. Dr. Otis, being the vice president of AGAPNA, talked about his platform. And so I think that in itself is everyone's responsibility. I don't think that it's fair for us to leave it for one person.
One more thing I can add. One more thing I can add is that the government of Ghana and in collaboration with maybe the media should do a great job with, putting up a lot of education pieces out there. Which I agree. The more Ghana, the more you saturate people's ears with the information, the more they're going to gravitate towards that. I mean, let's give the microphone to people who are experts to explain these things instead of giving it to the politician. I always will say that. That way, it will help with people's confidence, right? Let's be our own advocates. All health workers should be advocates of this vaccine, because when they get sick, they actually come to you. I have a friend who works at Confanachi, and he was just really devastated about it. The rate at which people are coming there and they're literally not able to breathe, but then he goes outside, nobody's wearing a mask. It is our individual responsibility as health workers to be advocates, to be ambassadors. You're not getting paid from Pfizer, neither are you getting paid from Moderna, none of that. It's just that it all comes back to us as health workers. So that is one thing that I advocate nurses, doctors, pharmacists, anybody in the healthcare to be their individual around their own circle. Get to know the facts about COVID and this vaccine, and then spread that information in your little circles. And then let's saturate the airways with information about the vaccine and how effective and safe it is.
I agree 1,000%. I feel that everyone should reach out to their Facebook community. You know, you can go live, you can talk about your own experience with COVID vaccine. If you have anyone who's experienced COVID, you can share that. But I do agree that one thing you said was very important is to spread only facts. And I think that that is a great commercial that we even have during our break, that there's been so many misconceptions, so many lies. So if you don't know something, don't spread it. Please follow the CDC website, the WHO website, but always make sure that you're telling people the truth about the COVID-19 and the vaccinations, 100%. And his last question is, how can we get to a point where we will need COVID-19 vaccine to travel? Oh, just like yellow fever, which we kind of addressed just a little bit. So what do you think about that? When do we get to the point where COVID-19 becomes the same thing as you need your yellow fever vaccine or your yellow fever card to travel?
I believe, as we vaccinate and we're able to control the infection rate, right, like below 5%, like we're seeing in places like California, which when the pandemic started, it was crazy out there. Now the infection rate or positivity rate is at 2.5%. Drastic change, right? When we do see that, then we know that we have control over the infection. There's still going to be a requirement for vaccination because there's variants coming out, right? Like the one from Brazil, a little bit scary because of the way the mutations are. So as these mutations and changes happen in the virus, it becomes very concerning to a lot of countries who have been able to control their infection rates to make sure that you don't import any other strains of the virus in that regard. So I anticipate that when the whole world, maybe a year from now, when a lot of places have vaccines, they will require you to have it before you travel to certain areas. It's just something that I predict, but it's just the interest of public health. That's why they will do that.
I agree. The interest of public health. So right now we're going to go ahead and take our closing remarks. It's 8:18. We appreciate everyone for staying with us so long. And these programs are brought to you to educate you. So if there's a topic or something that you are very interested in, please contact us and let us know so we can bring an expert on that specific topic to be able to address all your questions or concerns. Just because we are getting ready to sign out does not mean that we will not be able to answer your questions. Feel free to still put your questions there, and Dr. Otis, Dr. Ofori, or myself will make sure that we get back to you in a timely fashion. We'll start with our guest, as we always do. Dr. Otis, we are so grateful that you were able to come and share all your expertise with us. We appreciate your presence and all the time you spent for us. Do you have any closing remarks for us today?
I just want to say thank you. Thank you, Eunice, for what you do for the Ghanaian community in the United States, and what you do for Gap. You know, sometimes I personally talk to you on the phone. I question you how you find time to get your hands in all these great organizations. You need to teach all of us so we can extend our wings and help our brothers and sisters. Thank you so much, Dr. Ofori, for your knowledge. And the only thing I would say is that, you know, this is real. Let's educate. Like Dr. Ofori made a very great remarks that listen to people. Just because they have these misconceptions and they listen to these videos that miseducate doesn't mean you blow them off. Listen to them, you know, find out why, and maybe you'll be able to change their minds, right? So that's a good takeaway. Thank you so much for having me.
Thank you. And thank you once again for accepting our invitation to join us this evening. We really appreciate you. Thank you. Dr. Ofori, any closing remarks?
Yeah, so I'd like to express my sincere and heartfelt gratitude to you, Dr. Otis, for coming on our show. We really appreciate it. We always want different brains, different ideas, and learning about different areas in health on this particular show. So we'd like to thank you once more time. And to you, Eunice, of course, we can't thank you enough. And all the wonderful audience watching us right now, what I would like to say is that your health is in your own hands, right? The mask that you wear is more than almost 100%, especially if you have an N95, protecting you from COVID, right? So just put it on so you get a vaccine that can actually offer you that protection. Make sure you avoid crowd. And one thing I realized, and it's very common, is that people tend to trust their family members that they don't have the COVID. Do not trust anybody. Don't take that off just because you met a family member. That's how a lot of people actually got sick and actually died. So I would like to entreat, especially Ghanaians, our positivity rate is double digit, which means that if you picked at least 100 people, 10 of them will have the infection, which is not looking good. And therefore, I entreat everyone to wear their mask. Don't put it as a chin guard or any sort of way of wearing that is not effective. Then, it doesn't help. So please make sure that you take your own health into your own hands. And we will meet once again, I think in 2 weeks, right?
Absolutely.
Yep.
Thank you, Dr. Ofori. Once again, I would just like to thank everyone for joining us tonight. Once again, our program is meant strictly to just enrich our population and educate us all. So again, if you have any questions or concerns, please feel free to reach out. One announcement I would like to give is that the Council of Ghanaian Churches, in conjunction with Ghana National Council, will be holding a Thanksgiving service for 64 years of independence for Ghana, which will be coming on Saturday, March 13th. It's going to be held via Zoom, so we can do our part to make sure that people are not spreading any COVID-19 virus. Also, don't forget the GNC Scholarship is going to be available. Make sure you contact Ms. Abena Ampofo if you have any questions. Deadline is March 15th. Also, if you are a nurse practitioner or a nurse anesthesiologist, make sure that you check us out, AGAPNA. We are open to everyone to join. We have great programs, as Dr. Otis described to us. We are trying our very, very best to bridge the gap and help our community both here and in Ghana. I'd like to say a very warm thank you to all of our sponsors, Ghana National Council, Trend Africa TV, Holiday Africa, and Omama TV. Until 2 weeks from now, we encourage everyone to continue to be healthy. If you have the chance to get the vaccination, please be vaccinated and please share your information. Only truth. If you have any questions or concerns, always reach out to the CDC or the WHO organization. We thank you once again for your attention. God bless you all and have a wonderful night. Take care.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
It's Hot Topics exclusive.
shake it. Kinjere no machi baby, we are shake it. I feel wait there, you call anymore. Shake it. Sele masakule, masangalia. I say everybody, where they hit him, brother man, we are shake it. Futa wori now, we are shake it. Kinjere no machi baby, we are shake it. I feel wait there, you call anymore. Shake it. Me who betray me di masem to wani. Sase me ni binti, omo frame me kwa mi ahi. Zakawa me to me nye, me sronya mi. Sensi o beto, nama kofa tapoli, masemi ya mabo. Na komu di mi nisi ka mi di beto. Yala, ine baka iha, tatangene. Nkaka bata, sunana. If you can't help me, I say don't hate me. Cause everybody gets in life, oh. You fear saying, I say everybody, when they hate him, brother man, we are shaking. Futa wori now, we are shaking. Kinjere no machi baby, we are shaking. I feel wake there, call anymore. Shaking. Sele masakule, masangalia. I say everybody, when they hate him, brother man, we are shaking. Futa wori now, we are shaking. Kinjere no machi baby, we are shaking. I feel wake there, call anymore. Shaking. Sele manakule, masangalia. Say we are here. This one me obi wati. Answer and see over top. I cry for dada. Oh yeah, mama. This one me yeah dada. Kanya mi onu. Oko biji mi ni me bashe. Oba jofo. Kasapa mo mu feel why.
Maka maka. Royal Black says the Abba. Maka maka. Entertainment and sports. Oh. Maka maka. I say politics. Maka maka. Royal Black says. Assembly safwa. Bie assembly punu. Sane pia de kami. Ekome ya kotokumi. Ekome ya misegbe. You want love fake hanye. Maka maka. Royal Black says the Abba. Maka maka. All the trending issues. Maka maka. I say politics. Maka maka. Entertainment and sports. Oh. Maka maka. RBJ the Abba. Where you full from cry. Asemi safwa. Yeah, asemi punu. Sa semne ba. Ya dia ye beka. Senye betino. Sapepepe na ye beka no. Maka maka. Akesane kwete wo. Wabayue no ni wona je no na ke. Wabayue no ni wona je no na ke. Say your politics RBJ beka. Obeka. Eye sports RBJ beka. Obeka. Entertainment suhe RBJ beka. Obeka. Trending issues RBJ beka. Obeka. Maka maka ye diaba o ye beka. Maka maka ye diaba o ye beka. Royal Black says diaba o ye beka. Royal Black says diaba o ye beka. Assembly safwa. Bie assembly punu. Sane pia de kami. Ekome ya kotokumi. Ekome ya misegbe. You want love fake hanye. Maka maka. Royal Black says the Abba. Maka maka. All the trending issues. Maka maka. I say politics. Maka maka. Entertainment and sports. Oh. Maka maka.